Those who contract the virus are not infectious until they actually become sick.
But there is still a lot of fear and a lot of confusion surrounding the Ebola virus. Dr. Zorba Paster joins us tonight from his clinic in Oregon. Hi, Zorba.
Hi, great to be here.
Great to have you. So what do you think? Do you think we're overreacting to this threat, or do you think all of this news coverage and all of the precautions being taken are justified?
I think we're overreacting. And this reminds me of the same overreaction that occurred when HIV/AIDS started. If you remember, children who had AIDS were shunned at school. Many people were shunned. They thought that simple contamination would occur out of the blue. And the same thing happened years ago. And this commonly happens until people get educated as to what the problems actually are. And that's really important for Ebola, too. The risk is minimal, but the risk is there. But it's so infinitesimally small.
All right, well, let's talk about the president, the new guidelines that were released today. What do you think? I mean, you've had a chance to see them, and what are your thoughts of those new guidelines?
Well, I think the CDC, this is something that happens in the evolution. The CDC is quite good. They looked at guidelines in the emergency room of how people are to be protected. They looked at guidelines of what we in the medical profession should ask when patients actually come into the office. For instance, have you traveled out of the country? If so, where have you been? Who have you come into contact with? Those are very, very important guidelines. But right now, the CDC said if someone is not sick, they shouldn't be quarantined. And if you go to Google CDC, you can see exactly what the guidelines are. They're minimal risk, high risk, and so on. And those are the things that we should all be following. It's sort of a fright at this point because people have clearly become very confused and afraid of Ebola.
Well, let's clear up some of the confusion about the symptoms of Ebola.
Yes. Yes. So if we start out, one of the symptoms can be nausea and vomiting. You can also have diarrhea. You can have red eyes. You can have a raised rash, stomach pain, severe loss of weight. And the real issue is it tends to be hemorrhagic. And hemorrhagic means that when you have a diarrhea and you're vomiting, there's blood associated with it too. Now, it's important to remember that Ebola has been around since the mid-1970s. It was originally in Marburg, Germany. There are two viruses that are like it. It's been around for a long time. It's just that in Africa at this time, in certain countries, it has reached epidemic proportion. And I think the side important thing for us to remember is that 5,000 to 40,000 people a year in the U.S. will die of influenza. And while we're thinking about Ebola, if we're not getting our flu shot, we're not actually keeping our eye on the ball. And I think that's important for people to remember. There is something that they can protect themselves against today. It's not Ebola, it's influenza. Let's put it into context.
Yeah, that's important. Keep in mind what the real big killers are in the United States.
Exactly. And influenza has reared its ugly head in Wisconsin. There are a number of people who are hospitalized and very seriously ill. We're going to have a big influenza epidemic this year.
Oh, wow. Okay. All right, Dr. Zorba, as always, good to see you.
Good to see you, Zorba. Thank you so
pleasure.
much.